That was Robert Kemp, economist and professor at the University of Louisiana. More than 90% of the world has licensed private doctors, but in China, it's still a new concept. Chinese doctors are increasingly leaving public hospitals for the private sector. Lin Nan tells us why.
Dr. Smile, that's how Zhang Qiang styles himself. He's China's foremost expert on vascular surgery and holds 2 national patents. But his days working in a public hospital were anything but great. He left public health care in late 2012 to become a private doctor.
In public hospitals, patients don't have enough interaction with doctors. Their trust mainly falls on hospitals rather than doctors themselves. While in clinics, we are responsible for patients directly. It makes us busier, but it brings us more self-satisfaction. I feel more like a real doctor.
The public hospital system required Zhang to see more than 100 patients a day, while in private practice, he sees no more than 9 patients each day. And he earns as much as an entire department at a top-tier public hospital. But more freedom also means more risks.
When doctors become independent, realities of the market hit them. Their incomes and reputation depend on their medical skills and services. They can no longer get protection from big organizations.
In 2009, the Ministry of Health opened the door to private practice by allowing doctors to practice medicine at multiple sites. Rising tensions between doctors and patients, poor pay, and other unfavorable working conditions have driven more doctors into private practice. Dr. Gong Xiaoming is currently practicing in both a public hospital and at private clinics.
In the public hospital system, doctors are poorly paid, and some of them choose to take bribes from patients or overprescribe drugs. In public clinics, doctors can make decent pay from their skills and services. Market prices will reflect their value.
While giving doctors more choice and better working conditions, the dual system also allows doctors to practice at multiple sites, maximizing the country's medicine talent.
It is mutually beneficial for doctors and hospitals. Public hospitals can keep good doctors stay in by allowing them getting more pay in private clinics. Also, more good doctors can come to our hospital at their second or third practice site.
Currently, China maintains heavy limitation on private clinics. They are excluded from the health insurance system, which covers over 1.3 billion people. To bring dignity back to the Chinese doctors, maximize their potential, and minimize the constraint of health system, the road for Chinese medical reform is still long. Lin Nan, CCTV, Shanghai.